Polycystic ovary syndrome or PCOS is a set of symptoms due to elevated male hormones in females. Male hormones called androgens. Signs and symptoms of PCOS include irregular or no menstrual periods, heavy periods, excess body and facial hair, acne, pelvic pain, difficulty getting pregnant, and patches of thick, darker, velvety skin. PCOS is the most common endocrine disorder among women between the ages of 18 and 44. Its associated conditions include type 2 diabetes, obesity, obstructive sleep apnea, heart disease, mood disorders, and endometrial cancer. PCOS to be present if any 2 out of 3 criteria are met in the absence of other entities that might cause these findings. First is oligoovulation and or anovulation. Second is excess androgen activity, and third is polycystic ovaries by gynecologic ultrasound. The diagnostic criteria is called Rotterdam criteria, and according to it, 18% of women had PCOS. So what are the signs and symptoms of PCOS? First is the menstrual disorders, in which fewer than 9 menstrual periods in a year or no menstrual periods for 3 or more consecutive months. Other types of menstrual disorders may also occur. Second is infertility. Infertility results directly from chronic anovulations or lack of ovulation. Third is high levels of masculinizing hormones, known as hyperandrogenism, and the most common signs are acne and hirsutism, or male pattern of hair growth, such as on the chin or chest, but it may produce hypermenorrhea or heavy and prolonged menstrual periods, androgenic alopecia, or increased hair thinning or diffused hair loss. Metabolic syndrome. This appears as a tendency towards central obesity and other symptoms associated with insulin resistance, serum insulin, and acanthosis nigricans. Although 80% of PCOS presents in women with obesity, 20% of women diagnosed with the disease are non-obese or lean women. Causes of it is due to the combination of genetic and environmental factors. Risk factors include obesity, a lack of physical exercise, and a family history of someone with a condition. The syndrome acquired is most widely used name due to the common sign on ultrasound examination of multiple or polyovarian cysts. These cysts are actually immature follicles, not cysts. The follicles have developed from primordial follicles, but the development has stopped at an early antral stage due to the disturbed ovarian function. The follicles may be oriented along the ovarian periphery, appearing as a string of pearls on ultrasound examination. And what about the treatment? Actually, PCOS has no direct cure as of 2020. Treatment may involve lifestyle changes such as weight loss and exercise. Birth control pills may help with improving the regularity of periods, excess hair growth, and acne. Goals of treatment may be considered under 4 categories. First is lowering of insulin resistance levels. Second is restoration of fertility. Third is treatment of hirsutism or acne. And fourth is restoration of regular menstruation and prevention of endometrial hyperplasia and endometrial cancer. Metformin and anti-androgens may also help. Other typical acne treatments and hair removal techniques may be used. Efforts to improve fertility include weight loss, clomiphene, or metformin. A major abnormality in patients with PCOS is the failure of regular, predictable ovulation. Thus, these patients are at risk for the development of dysfunctional bleeding and endometrial hyperplasia associated with an opposed estrogen exposure. Endometrial protection can be achieved with the use of oral contraceptives or progestins, such as medroxyprogesterone acetate 5 to 10 mg or prometrium 200 mg daily for 10 to 14 days of each month. Oral contraceptives are also useful for management of hyperandrogenic symptoms as spironolactone and ceproterone acetate. Successful weight loss is the most effective method of restoring normal ovulation or menstruation. The American Association of Clinical Endocrinologists guidelines recommend a goal of achieving 5 to 15% weight loss or more, which improves insulin resistance and all hormonal disorders. Metformin is a medication commonly used in type 2 diabetes mellitus to reduce insulin resistance and is used off-label in the UK, US, AU, and EU to treat insulin resistance in PCOS. In many cases, metformin also supports ovarian function and return to normal ovulation.